All right, so this is. I figured I'd make a a blog, a vlog. May as well show our trophy. But okay, so I'm making a vlog for my recovery from my second shoulder surgery in 3 months. First one was a slap tear to the labrum with a shredded biceps tendon long head, a lot of bone spurs, and various cleanup of partially torn rotator cuff tendons. And it was the surgery went fine. I opted to do it under a regional block with no sedation, and then some local anesthesia at the insertion points. And I think the surgery went great. And then I, like an idiot, in the first week, tried to catch my dog as she stumbled backwards down some stairs with my left hand, and it tore the biceps tendon almost completely. So 3 months of PT, and then I finally, and my insurance is about to recycle, so I was like, I got to get another surgery. So went in there today, and it was an hour and a half where he explored it arthroscopically, the capsule, and saw that there was barely a tendon left. So then he had to make an incision along the ventral belly of the biceps of the arm of the humerus and go in there. And then because I was awake again and listening to him talk to the assistant, I got to hear all this stuff, which included, oh, there's a lot of scar tissue. The two heads of the tendon of the biceps have scarred together. Their tendon's really almost not there at all. So after 30 minutes of this, they finally secured what they figured was a useful chunk of the muscle with barely a little tendon left at the end.
Got an itch.
And then they pulled, and I felt a noticeable pulling. Pressure and stuff still works, so you can still feel that, but there's no pain. There was a noticeable pull, and then a noticeable release, and then a noticeable shit, and then silence. So I was like, that doesn't sound good. So then he was like, well, and he explained it. So he continues, and then they're digging around down there, and this went on for an hour. There was an hour of this hour and a half surgery was digging for my muscle. And they finally got what they figured was a good chunk, and then they found a good piece of fascia that was part of the tendon of my pectoralis major long head. They secured what they could of the long head of the pectoralis major. Did I say pectoralis major long head? I just meant pectoralis major tendon. So they secured what they could of the biceps long head tendon, biceps long head tendon. And I'm not on any pain relievers right now. I'm just gibbery. Connected it to that fascia of the pectoralis major and stitched it up. The things I could feel were the electrocautery. The electrocautery didn't feel great. The incision and stitches didn't feel great either, but they were not nearly as painful as the open hernia surgery repair I had under local anesthetic 3 weeks ago, which included an electrocautery. And by the way, I would recommend regional blocks if possible, because I like to experience it. But if you're gonna get an umbilical hernia and you want to do it under local, and the surgeon says yes, change your mind, because it's no fun, right? Even the 100 micrograms of fentanyl that I ended up getting was not enough to dull the pain seemingly remotely. But anyway, back to this surgery. So I'm all tied up in here. There's the bottom of that incision, and over the next few days I'll be showing it to you. That muscle had assumed a slump, that Popeye deformity. My hand is a complete dead man's hand. There's no way I can wiggle a finger, I think. Wiggle. But it's not, there's no, the baby finger and ring finger I have like your foot's asleep if you've been on the can too long, and the thumb and two first fingers can't feel anything. Okay, well, I guess I'll just cut this here. If I think something, I'll post it again, but I'll do a shout out. I'm in Fort Worth, but Shout out to Shreveport Rugby for making this t-shirt that was big enough for me to wear today 25 years ago. And a shout out to well, this doesn't say our thing. This is San Antonio Rugby, but this was like a long time ago also. But shout out to the Grand Prairie Mavericks, my rugby team. Of course, that's what I was doing when I got this injury, but still, I'm going to come back and play again. All right, I'll update.